Welcome back to Medicam Tube. Today we will know how to drain pus from an infected foot safely. Please watch the complete video to know all about the topic. For further details and reading material, please read the description section of the video. Stay tuned with Medicam, a great source of medical knowledge. Please leave a thoughtful comment in the comment section below. But before we proceed, if you are new on Medicam, please do not forget to like, share, subscribe, and hit the bell icon for instant and regular updates. Let's start. Read more for deep learning. To ensure a safe and thorough draining of pus from an infected foot, start by gathering all necessary supplies: sterile gauze pads, antiseptic solution, rubbing alcohol, a sterilized needle or lancet, antibiotic ointment, non-stick bandages, and disposable gloves. Begin by washing your hands and putting on gloves to prevent the spread of bacteria. Next, cleanse the infected area on the foot by wiping it with a sterile gauze pad soaked in an antiseptic solution to reduce bacterial load and minimize infection risk. Soak the foot in a warm saltwater solution, made with a teaspoon of salt in a cup of warm, sterile water, for about 15 to 20 minutes. This soaking helps dilate blood vessels, promote circulation, and soften the skin around the infection, which can encourage drainage. After soaking, gently pat the foot dry with a clean, sterile towel. When the area is soft, examine the abscess closely. If it appears that a head has formed, a white or yellowish raised spot, sterilize the needle or lancet with rubbing alcohol. Using gentle and precise pressure, insert the needle at a shallow angle just enough to pierce the skin over the softest part of the abscess. Allow the pus to drain naturally without squeezing too hard, as too much pressure can push bacteria deeper into the tissue or spread the infection. Once drainage slows or stops, gently blot the area with sterile gauze to remove any remaining fluid. Clean the area thoroughly with antiseptic, and then apply a thin layer of antibiotic ointment to prevent further bacterial growth. Cover the wound with a non-stick sterile bandage to keep it clean. Change the dressing daily or if it becomes moist or dirty, and reapply the antiseptic and ointment each time. For the next few days, monitor the wound for any signs of infection, such as increased pain, swelling, redness, heat, or drainage. If you notice any of these symptoms or if the infection worsens, consult a healthcare provider promptly, as this could indicate a more severe infection that may require antibiotics or further medical intervention. Avoid walking barefoot or placing excessive pressure on the infected area to allow healing, and keep the foot elevated whenever possible to reduce swelling.